Thank you all for watching today. We are excited to introduce InterSystems Go the Distance as part of our demo competition. So before we get into what we're showing, I'm going to talk a little bit around the background of why we created Go the Distance and what problems it solves as a next generation care management solution. So to give some perspective, we're going to look at this from the perspective of a chronic condition, in this case, diabetes. We'll look at this pretty quickly, but some key things to know. The cost of managing a diabetic population has steadily increased from, in this case, 2017 all the way through to 2023. This includes both managed costs and unmanaged costs. And we can see that there's a shift towards unmanaged costs, which represent things like inpatient visits. So this trend underscores the worsening of management of these chronic conditions, which leads to higher utilization and more expensive services. We can also see this green line that shows a health plan's average stars rating, also between 2017 and 2023. And we can also see that it's declining after its peak in 2021 at 4.3 stars. Recent changes in CMS weightings and increased emphasis on clinical outcomes has caused a decline to 4.0 in 2023. So this kind of amplifies those financial penalties associated with declining stars rating. There is financial and operational implications as well. So investments in preventative care remain relatively stable, but they're becoming insufficient for offsetting these rising unmanaged costs. And then the unmanaged cost growth reflects gaps in care coordination. So really, what's the call to action here? Plans really need to focus on closing these care gaps and enhancing data-driven interventions so that they can control the costs while improving the quality of their care. And so with that, we introduce InterSystems. Oh, sorry, before we do that, let's talk about the current state. And then we'll introduce InterSystems Go the Distance. So in our current state, let's talk about how our care management systems get data. So we have a treatment event now for health plans. That's going to really be claims data that's driving the receipt of that information. As we know, claims data is delayed. So we know that there's challenges in getting kind of that real-time action, and the data tends to be incomplete. From there, that data moves to reporting tools. Challenges with working with these reporting tools is that there's a lack of advanced features for analytics on both care gaps, as well as how to engage with these members. When those reporting tools end up outputting a cohort that needs to be managed, that moves to our care management systems, which creates these large care caseloads. And for our end users, there's a limited tool set on who to focus on. And then from the communication standpoint, we also have limitations on how to reach out to these folks. There's kind of a manual prioritization, manual outreach that falls on our case or care manager to be able to manage that. So we look to tackle all of these problems with our demonstration or our solution for Go the Distance. Some key aspects of InterSystems Go the Distance: we're working with rich information. So we're leveraging up-to-date clinical information to accurately assess the population. We're working with near real-time dashboards to assess HEDIS performance alongside member engagement information, which is critical, which we'll see in the demonstration. We're working with integrated communication tools, so being able to work with personalized outreach mechanisms, whether that's email, whether that's through an app notification, so that we're able to meet members where they're at. And then having options to plug in advanced analytics, so leveraging predictive models to identify and prioritize members that have the greatest need of intervention or outreach based on medical history or even prior engagement levels. So it's really about taking not only the clinical information or the rich data that we know about the member, but also combining it with the information that we know about their patterns of engagement. So with that, we will switch over to a brief demonstration of Go the Distance.
All right, thank you, Jess. We have a prototype of our application here that we'll demo for you today. This is our web-based self-service dashboard designed specifically for health plans to check on how they're performing on various HEDIS treatment measures. This dashboard is fueled by all the clinical information, social determinants, and all the rich data that flows into the unified care record so that health plans are not completely reliant on just claims data. On the left, we have our treatment measure categories that are accounted for in the HEDIS scorecard. And today we're going to be focusing specifically on diabetes. So when we click on any of the category, each category displays interactive dashboards based on all of the unified clinical data that exists in Unified Care Record. The pie charts provide a numerator and delta for each treatment measure, and we can see the number of patients that meet the requirement and then the number of patients that do not meet any of these specific requirements. So we can select the pie chart to see all the patients who have not had eye exams in the last 12 months. These charts dynamically change as new data comes into the systems and as time passes, and this list of patients down here will update with those changes of data in the passage of time. So for the patients with no eye exams, we can see their contact information. We can see the date that their last eye exam occurred. We can see their last care touch point, and we can see what the response to that touch point was. And then we can also see this icon on the right here that tells us if care management is already in progress for this patient. Since Marla Gonzalez here did not answer our last touch point, I can click the checkbox next to her name, click this notify button here, and now I have the option to send an email or an SMS message to the patient. This pop-up's loaded with the last message that was sent to the patient, so we can tweak that, or we can use this button down here to generate an AI suggested message with the appropriate appointment type. So with the communication type selected and with the message entered, we can easily send this message to the patient, but for right now, we won't bother Marla, so I'll just click cancel. If we notice that a patient is not responding to any of our automated touch points or they've been flagged for high risk, we may want to assign them to a care manager for some more tailored communication. So we can just click that checkbox again and click add to care management. And we see that that patient has been added. If a care manager wants to see more information about Marla or any of these other patients, each patient's name is actually a link to the clinical viewer. So if you click on this link, you're taken to the clinical viewer for that patient. So you can see all the unified data for Marla, and you can see a summary of all the data that's most relevant to the care manager right here. And the clinical viewer can also be customized, so it can present the most relevant information in this summary to the care manager. I'm also going to go ahead and click on this custom CRM tab that we've created here. So now we can see all the touch points that we've had with Marla and how she's responded, and we can actually get some recommended next action steps. This will help us improve Marla's care and ultimately Marla's health, because population health starts with one patient at a time.